was invited to give my my point of view about cancer, and that is quite different from the conventional and alternative carer. My point of view is that the cancer is caused by a fungus, and if we want to heal people, we have to fight against the fungus. This is my position that I will explain. I will try to explain to this audience. When I was younger, I was at university, I guessed that the psoriasis is a fungus, and I was used to get rid of it with solutions of iodine tincture. The purpose was to destroy the fungi that, in my opinion, were the cause of the psoriasis. Usually, the psoriasis is thought as an incurable illness, but I was able to cure it. Then, in a moment of desperation, I made a syllogism. If the psoriasis is a fungus and the official medicine says that it's incurable, maybe another incurable illness, the cancer, is a fungus. In that moment, I had the inspiration and went on with my experimentations. See, I started from the psoriasis, and then the first tries revealed at once that I was in the right way. Iodine tincture for the skin cancer, for melanoma, basal cell carcinoma, epithelioma, and psoriasis when the plaque is not too big. Externally, you can use iodine tincture. For the internal organs, you cannot use this solution. And right from the first inspiration, I thought, how can I kill a fungus inside the body? And I remember that in the pediatric oncologic wards, the nurses were used to get rid of the trash of the baby with the sodium bicarbonate. And hence I started to use sodium bicarbonate solutions. One of the first patients that I treated was a young boy, 11 years old, with localization, brain localization from leukemia, and he was in coma. After 15 days, I gave him the sodium bicarbonate solutions, and he woke up in 7, 8 hours, and everybody was crying in the ward. The mother included, that asked me that would have given a treasure to speak with his son before he died. And gradually I started to cure people with sodium bicarbonate solution, but the problem was to reach for the tumor, for the mass, directly with the sodium bicarbonate. And I started with intravenously administration, then arterial catheterization, for instance, for the liver, the prostate, rectum cancer, brain cancer, and then for the cavity, I used the catheters for the pleura, for the abdomen, mesothelioma, or metastasis into the abdomen. And after that, I counted also on surgeons. It's easy to get rid of tumors if a surgeon can cut off just a lump and continue the treatment with the sodium bicarbonate solution, able to sterilize all the area. This is the way that I went on. The big problem that I find, especially when I go to the USA, where there are hundreds, thousands of alternative treatments. I was the president of the scientific committee of the biggest federation of alternative association in Italy. And every carer was fighting against the other one because he thought his method was better than the other one. But I asked to the carer, to the scientist, to the naturopath, I don't know, please, before proposing any cure, please show 3 evidences. 4, 3, just 3. CAT scan before and after the treatment. MRI or ultrasound or pictures before and after the treatment. I've never seen a result. That's a pity, because the future of the medicine is in the alternative field. But there are too many speakers. So that's why the official oncology can survive, because alternative people don't confute the official oncology in a scientific way. Oh, emotionally. I spoke with a carer that wrote a book. I saw people that wrote hundreds of books of stupidities. The passion, emotionally, veg, herbs, and what, I don't know, diet, and psych. And see, yes, concomitant causes are important. It is important to support the patient, to reinforce the patient generally with the alternative, also with alternative methods. But if the cancer is a fungus, you have to kill it. Simply, you have to kill it. Because if you reinforce, you don't get rid of anything. If you have a killer that entered into your house, you cannot repair the door. You have to kill him. Otherwise, he will kill you. When the fungus is inside the body, it is impossible for any alternative treatment to get rid of it. I saw big tumors after the alternative treatments. For sure, the alternative treatments are better than the conventional treatments. The conventional treatments kill the patients. The alternative treatments don't do anything, so it's better don't do anything than kill people. This is the problem. Too many metaphysic ideas. And even though we need of alternative point of view to generically, how do you say, help people, help patients. But this is an aside treatment. It is not enough. You have to kill. If somebody has a tuberculosis, you can reinforce. You can analyze all the elements that led the patient to the tuberculosis. But it is better to kill the tuberculosis. Mycobacterium or tuberculosis. Then, in this case, for the cancer, you have to kill the specific cancer that is a fungus. Furthermore, in the plant kingdom, all the tumors are due to fungi. All the insects have the specific fungal killer. Why for the human is not reasonable, in your opinion? Because it is more difficult, and because an idiot theory made at the beginning of the last century said that the cells start to get mad, and they start eating their body or destroy their body. Is the same as you think that a man or a person start to eat his hands. This is an insane theory, but the worst is that today, after hundreds years, oncologists continue to repeat, like parrots, the same litany. Cellular anomaly. What is this? We don't know, we don't see, but it exists, does exist. We are in a world of insane parrots. And taking account that the theories, theories on cancer are made by the biologists that don't know what is a patient. So this is a strange way to cure people. But the problem is not the pharmaceutical industries, because at the end they make their business. The problem is that the society is set up as in a middle age. We have some institutions that are a mess. So politicians are guilty. Why they let survive the medical orders? Why they make laws that are pushed only by the pharmaceutical industries? There is no protection for the individual. So the real problem are the institutions. Too many institutions that imprison people, imprison the individuals, imprison the thoughts, imprison the doctors. You know what happened in Italy? When I have a consultation with patients, for instance, one of the last patients with the breast cancer, she told me, I went to the hospital of my town in Arezzo. I spoke with the oncologist. I told him, oh, I know I don't want to be operated because I know that the cancer spread after the operation. And the oncologist responded to her, don't worry, we make the operation and we use sodium bicarbonate solutions before and after, and we sterilize all the area. So she asked, so you do the method of Dr. Simmoncini? Is stumbled, and he said, oh yes, we know that it is effective, but we cannot say clearly because will ban us. So this is a sad situation. In many hospitals in Italy, they use sodium bicarbonate in secretly. But the octopus, the big monster that rules all the medicine, pharmaceutical industries, and the institutions, they ban whoever makes the sodium bicarbonate solutions. They ban people, doctors in Canada, in USA, in Mexico, in Ecuador, in France, and in UK. In my opinion, there is one of the most strict system in the world. It is unbelievable. When I meet with the English people, let's say of the United Kingdom in Italy, they are really, really sad, concerned, because they cannot do anything here. Even if they want to sell a syringe, they have to ask the authorization to the doctor. This is a system, a middle age, of the Middle Age. When I was in Madrid, the oncologists and the doctors came to me and told me, you are a conventional doctor at the end. This is a new theory, but it is conventional. Infectious theory, one drug, allopathic, results. The alternative people came to me, most of them, they said to me, you destroyed us, because what do we do? When I make the conferences and I speak about oncology, I suggest people to cancel and to refuse doctors, scientists, religious, and politicians that come and they appear authoritative. Because they first, when they are authoritative, they have the arteriosclerosis. So when they want to look authoritative, they just want to deceive people. Understand me? Oncologists, scientists, religious, politicians, blah, 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 blah. This is the talking of the authoritative people. It's a big problem. The humankind has to start to understand that people have to set free, and we have to love people, because if we love people, people give us energy, goodness, and joy of life. If we beat people, oh, we can earn, we can dominate, but we are just. This is the problem. So this is an ethical point of view. And also my point of view of the medicine, of the oncology, is to help people. That's why I went out of the mainstream. I was in the oncologic world. I was doing the chemical therapies with chemotherapy. Everybody died. I was young. I told my professor, what are we doing? We are sellers of tablets. But no research. What? The patients get worse, die. What are we doing? Because a simple soul, a natural soul, sees at once this fraud. What we have to think of? It's clear. 9 million people dying for every year is a problem that cannot be misunderstood. 9 million people. So we cannot continue to say the litany of the cell that become mad. So we have to be honest. We have to be in our soul simple, natural, honest, and the truth will come to us. Otherwise, we just behave like parrots. I want to say that this problem is all over the world, in all the countries, Western, Eastern, South, North, is the same fraud. I traveled a lot. In the last months, I was in Ecuador, Mexico, USA, Iran, Israel, India, all over Europe, all over the Europe. But there is the same, always the same scenery. The same scenery. The oncologists say the same thing. They deceive people in the same way. If you go to the, I don't know, to London, or if you go to USA, today the oncologists, for instance, they say they don't do chemotherapy. Now, they make biologic therapy. What does it mean, biologic therapy? It is always chemotherapy, oral chemotherapy. But if you have a bullet that you shot, it is, if you call it natural, because it's iron, if you call a weapon, it's the same. They just say biologic treatment because they started to convince the patients, oh, this is biological. This is a false thing. This is a lie. Because now, the important thing for the oncologist is to learn how to make theater. So they, until the 70s, the medicine was a profession. From the 70 to 2000 years, it was like a business. From 2000 onward, it became a theater. Doctors, oncologists learn to say what the patient loves to be said, not the truth. Another big lie that they say usually, oh, we stabilize the illness, the cancer, because the patient accepts that he is ill, that has the cancer, but it thinks that he can survive. So so the patient continues to make chemotherapy, radiotherapy, kill therapy. But when they say we stabilize, what does it mean? They don't say that the cancer goes on. At the end, the patient dies. Oh, lies. This is the word of the lies. That's what I want to say. And I want to just to ask, if there is somebody that has a piece of soul and a piece of love for the other ones in the world of the medicine, please come up. Please, let's work. It is time to help people now. It is time to help people, and it is time to finish with the deceit of the oncology, conventional oncology, and with the stupidities of the alternative theories. That's all. Thank you.
The last person in order of time to propose a natural cure against cancer is Tullio Simmoncini, an Italian oncologist who finds himself in the middle of a storm after having declared that the origin of cancer is not genetic but it is due to the aggression of a fungus called Candida albicans. Based on this hypothesis, Dr. Simmoncini treats cancer with sodium bicarbonate, and his rate of success is encouraging to say the least.
What is a fungus? In other words, how do we get this fungus inside our body, or this yeast inside our body? Where do you think all of this starts after your years of research?
There is an endemic, a big epidemic pollution, because the fungus is undervalued. But it is undervalued because it is not understood.
From the beginning of his studies in oncology, Dr. Simmoncini felt the need to reconsider the cancer paradigm from scratch, and began looking for a different origin of the disease. What puzzled him the most was the fact that all cancers behave in the same way, even though they occur in the widest variety of organs. He then started looking for a common denominator, and believed to have found it in the fact that most cancers appear white. These tumor specimens show the devastating impact the disease can have on the body. This is a liver riddled with cancer. The whitish bubbles are all tumors.
If you enter in the body and you reach an organ affected by the cancer, you can see that the lumps are always white.
The lumps are white?
Lumps are always white. Sometimes it is covered with blood or with the defense reaction. But in every post-mortem examination, scientists find the white lumps, the white masses, that is fungi. This is the pleura. We entered with the camera and look, the pleura should be red, but you can see all the lumps, all the cancer that is white. This is the heart beating. This is a bronchial cancer. Look, we went into the bronchia. Look, they are white. And then in the colon cancer, this is red because there is a little bit blood. I washed it up.
Okay, and now it's white.
Now, look. It is always white.
White, like Candida. Candida albicans in Latin means glowing white. It should be clarified that the presence of fungi in tumors is nothing new in the medical world. Official oncology, however, believes that their presence in tumors is due to their opportunistic nature, which brings the fungi to build colonies wherever they find a suitable environment. This belief, however, seems contradicted by a careful observation of what happens in the lower hierarchies of the animal world.
Spores from a parasitic fungus called Cordyceps have infiltrated this ant's body and mind. As soon as she is discovered by the workers, the ant is taken away and dumped far away from the colony. It seems extreme, but this is the reason why. After a while, the fruiting body of the Cordyceps erupts from the ant's head. It can take 3 weeks to grow, and when finished, the deadly spores will burst from its tip. Then, any ant in the vicinity will be in serious risk of death. The fungus is so virulent, it can wipe out whole colonies of ants. And it's not just ants that fall victims to this killer.
In this case, it was the fungus to cause the ant's death, not the death of the ant to invite the presence of the fungus. What normally appears to be a simple opportunist is in fact a full-fledged assassin.
Allora viene il dubbio, non sarà che viene prima debilita l'organismo e poi nel momento in cui la si vede è il momento della massima invasione? Chi ci dice che sia solamente un post hoc? Il fatto che ci sia è un dato di fatto, il fatto che sia un post hoc è un'interpretazione.
So the oncologists and scientists say because the cancer invades the organism, it gets weak, and the candida that is opportunistic invade the organism. On the contrary, I say that the candida enters to the organism, makes the cancer, destroy the organism, then explodes everywhere.
Candida is a very familiar fungus, known especially to women who sometimes experience an infection in their sexual organs.
The vagina is a muscular canal that leads from the outside of the body to the uterus. The warmth and moisture of this canal create a perfect environment for microorganisms to breed. For example, bacteria called lactobacilli, which are naturally present in the vagina, coexist with a yeast fungus called Candida albicans. Normally, the lactobacilli create an acidic environment that keeps the natural yeast population in balance. However, when conditions within the vagina change that either decrease the numbers of lactobacilli or decrease the acidity, these yeast fungi begin to multiply.
Normally, the immune system keeps the fungi under control and doesn't allow them to establish colonies anywhere in the body. Whenever a white cell identifies a fungus in the bloodstream, it immediately attacks it and destroys it. If instead the system's defenses get lower than usual, which can happen for a variety of reasons, the candida can manage to get around the immune system and establish a permanent colony wherever in the body.
Esistono le candidosi superficiali, quelle che attecchiscono sugli epiteli, le candidosi classiche del cavo orofaringeo, della vagina, eccetera, eccetera. E poi esistono le candidosi profonde, quelle in cui la candida è riuscita a sorpassare gli epiteli e il sistema immunitario e è riuscita a radicarsi nell'interno dell'organismo, in un organo. Il momento in cui un fungo entra dentro il tessuto connettivo nella parte interna dell'organismo, si chiama la candidosi intima, evoca una reazione di tipo immunitario cellulare che porta alla formazione del tumore. Il tumore, secondo me, sarebbe quindi l'insieme dell'invasione fungina più la reazione cellulare che l'organismo mette in campo.
Far from being a wild, uncontrolled cellular replication, according to Simmoncini, the growth of a tumor is a lucid and desperate reaction from the organism in a last attempt to reject the intruder. By the same token, Dr. Simmoncini believes that metastases are not cancerous cells that leave the primary tumor to go start a new one somewhere else, but small groups of fungi belonging to the primary tumor that fall inadvertently into the bloodstream during biopsies or during normal operations. These runaway fungi settle in a new environment and prepare to take advantage of a weakened organism to establish their own colony as soon as possible. Once this propagation has started, it becomes necessary to restore the immune system to its maximum potency. If the patient is given chemotherapy instead, this only accelerates the destruction of his natural defenses, as the drug kills indiscriminately cancerous and healthy cells. While possibly prolonging the survival by a few months, chemotherapy in fact makes it impossible for the organism to recover its defense capabilities, making it bound to succumb sooner or later to the multiplying fungal attacks. To test this hypothesis, Dr. Simmoncini considered treating cancer patients with sodium bicarbonate.
Sodium bicarbonate is the strongest substance against fungi. They cannot adapt to a salt because it is not a complex substance. That's why the antifungal today's antifungal drugs are ineffective, because the fungi can adapt themselves in 3-4 days. For a fungus, you give an antifungal drug, you can kill the first layer, but the second layer they get used and they eat drugs, chemotherapy, everything.
Gennaro Sangermano is the first patient ever cured by Dr. Simmoncini with sodium bicarbonate. In 1983 he was diagnosed with lung cancer and was given a life expectancy of 6-7 months at best. In 2006, 23 years later, he gave this interview.
Buonasera. Buonasera, io mi chiamo Massimo. Mi sembra di parlare con una persona molto fortunata, mi sembra di capire, giusto?
Sì, molto fortunato, veramente.
Perché i pesi...
Molto fortunato, ma grazie a Dio al dottore Simmoncini. Sono incontrato con fortuna perché mi hanno detto che bisogna fare un altro ricovero. Perché la macchia si stava allargando quando sono andato alla visita. E ha detto vieni da me, sono andato con la cura che mi ha dato lui, con grazia di Dio.
E ci ha messo, mi diceva la moglie, ci ha messo 8-9 mesi a guarire?
Sì, oltre 9 mesi.
Però se n'è andato via tutto il tumore?
Sì, per grazia di Dio, sì, che hanno ritrovato che è andato via. Non credere, però a me è andato bene.
Già è lì, infatti.
Ecco, perché mi hanno detto che c'aveva 6-7 mesi di vita addirittura.
Lei non ha fatto nessun'altra cura insieme a Simmoncini, cioè lei è sicuro che l'ha guarita questa cosa qua?
Sì.
Non ha fatto nient'altro?
La cura di Simmoncini altri non sono andati. Adesso solo che qui qualche raffreddore, la febbre, va da un altro medico.
Vabbè, chiaro, normale.
Allora, comunque la cura là me l'ha fatta solo lui.
Non ha fatto nient'altro insieme?
No.
Ho capito.
After a few successful treatments, Dr. Simmoncini presented his documentation to the Italian Department of Health, hoping that his theory was put to test under proper scientific protocols. Not only were his findings completely ignored instead, but Dr. Simmoncini ended up being disbarred from the Italian medical order for having prescribed cures that had not been approved by the authorities. This is rather unfortunate, as even the ancient Hindu books of medicine prescribe sodium bicarbonate against cancer. Alkali of strong potency should be used in diseases arising from anella, schlesma, meta, cancerous growth and such others which are very difficult to cure. This book is over 1,000 years old. As soon as the news on his treatment started to circulate, Dr. Simmoncini became the target of a major smear campaign, orchestrated through the Italian media, in which he was treated as a charlatan and a swindler.
Di Striscia oggi vi parleremo di un personaggio che dice di curare i tumori con il bicarbonato. Seguiteci. Buonasera, Jimmy Ghione, Striscia la notizia. Come va?
Niente, lascia.
Senta, ma com'è questa storia del bicarbonato? Ci può raccontare com'è che si curano i tumori con il bicarbonato? E ci può raccontare un po' com'è questa storia? Se basta il bicarbonato per curare i tumori.
Aspetti che vedi scendo.
No, aspetti,
aspetti che
ma perché fa così?
Dr. Simmoncini was also repeatedly sued for wrongful death and in one case sentenced to 3 years in prison for having allegedly caused the death of patients that had undergone his treatment. The media seized greedily on the trials, delivering the final blow to Dr. Simmoncini's credibility.
Professor Francesco Cognetti, direttore scientifico dell'Istituto Nazionale dei Tumori della Regina Elena di Roma, uno dei più importanti oncologi italiani. No, perché quando parliamo di medicina e anche di cure innovative bisogna stare attenti. Dice quest'uomo, sto Simmoncini, è un fungo, il tumore è un fungo e si cura col bicarbonato di sodio. L'impressione immediata di un grande medico.
Beh, una tesi bizzarra, voler essere ottimisti, e direi che è pazzesco, non c'è nessuna dimostrazione che ci siano rapporti tra infezioni fungine e neoplasie, né tantomeno che i funghi siano l'unica causa di cancro, come sostenuto dal dottor Simmoncini.
Possiamo dire con assoluta certezza che il bicarbonato di sodio al tumore purtroppo non gli fa nulla, se no sarebbe stato molto semplice
assolutamente
affrontarlo.
nulla, ma può essere, devo dire, anche pericoloso, perché se somministrato a dosi importanti può determinare squilibri metabolici importantissimi che possono compromettere la funzione renale, la funzione respiratoria, la funzione cardiaca, cerebrale, e quindi è un farmaco che, se somministrato a dosi importanti, può determinare anche la morte.
Quando si parla di potere, che cosa significa in pratica? Significa questo, che se uno dice una cosa nuova o grossa, come è successo a me, si attiva l'ordine, uno, mandano i giornalisti che dicono quello che vogliono, attivano denunce false, le magistrature, con cose inesistenti, ma tanto ti mettono il mare in mezzo, e alla fine uno deve remare contrario per dimostrare qualcosa di valido. E questo lo fanno con tutti, perché c'è, secondo me, una mancanza di lungimiranza.
The paradox is that Tullio Simmoncini is not an alternative doctor, nor is he against the current medical system, but he is possibly the most allopathic and orthodox of them all.
La strada per far fuori il fungo dentro, fuori e anche il tumore sia quella di concepire degli antifungini a cascata sequenziale. Il concetto in chemioterapia esiste, le terapie sequenziali fatte a cicli, eccetera, eccetera, perché bisognerebbe scogitare degli antifungini che sono efficaci in un primo momento, come il fungo varia, cambiare l'antifungino in funzione della variazione del fungo e così stargli dietro secondo le variazioni, però dovrebbero venire in campo le case farmaceutiche in questo momento, che adesso non capiscono questo grosso affare che c'è sotto. Loro vedono la multinazionale che fa, vede il pericolo dell'azzeramento dei chemioterapi, eccetera, e fa guerra, fa terreno bruciato a tutti. Chi dice qualsiasi cosa gli taglia il collo.
Notwithstanding the difficulties, Dr. Simmoncini has never given up the fight and keeps traveling the world, presenting his theory everywhere he is invited. In the meantime, he has perfected some special techniques that allow him to deliver the sodium bicarbonate in the vicinity of the tumors, obtaining the maximum effectiveness out of the smallest amount possible.
Sodium bicarbonate is effective if you can put in contact the sodium bicarbonate with the cancer. So, if you want to reach the prostate cancer, you have to locate before a catheter in the pudenda artery that reaches the prostate. Then you can administer through a port cat connected to the catheter the sodium bicarbonate directly to the prostate.
This is John Blankenship in Houston, Texas. I was diagnosed with prostate cancer in about August of 2007. They did a biopsy and later on scheduled me for radical prostatectomy.
Faced with the idea of losing his prostate, Blankenship started looking for a different solution and ended up choosing Simmoncini's bicarbonate therapy.
His belief that cancer was a fungus. And I arrived Rome on the 1st of February, and on Monday, on the 4th of February, we put a catheter in. So I flew back to the United States with the catheter in place and started on a treatment schedule of 6 days of infusions and then 6 days off for rest. And we did 4 or 5 of these cycles. I just took on Tuesday, the 26th of August 2008, a ultrasound examination of my prostate, and apparently the doctor, I consulted with him and he said he couldn't find anything. He wrote a report to that effect, and I faxed the report to Dr. Simmoncini today, and he was delighted with the results. He said it's all gone.
So, according to the ultrasound scan, your cancer is gone.
Yes, sir.
Can you believe that?
I absolutely believe it. I believe everything that Dr. Simmoncini says.
And then there are some type of cancer, breast cancer, doesn't need of the catheter, bladder cancer, brain cancer.
You're saying a urethral catheter can deliver sodium bicarb to the bladder.
La cura non esisteva di mettere gli organali di sodio diluiti al 5%, un po' normale, in farmacia, veniva un infermiere col catetere e me lo metteva in.
After 7 surgical interventions, the tumor in Mr. Giordano's bladder kept coming back, and he was told that the time had come to remove the entire organ. After consulting with his own doctor, he chose Tullio Simmoncini's sodium bicarbonate therapy instead.
Questa terapia, a distanza di una settimana, vado a rifare il controllo e era tutto sparito, non c'era più. È tutto pulito, non c'è niente.
This is confirmed by Mr. Giordano's doctor.
Adesso i risultati ci dimostrano effettivamente che questa terapia è stata efficace, efficacissima, vista la guarigione, e io penso che questa terapia sia veramente una cosa innovativa, una fortuna che ci sia, insomma.
Lei è medico, diciamo, generico?
Medico chirurgo, sì, medico di famiglia.
Another organ easily accessible with the sodium bicarbonate solution is the uterus.
Nell'ottobre del 2007 mi hanno diagnosticato una displasia della cervice del collo dell'utero, vale a dire che ho saputo intorno al 27-28 dicembre di avere un carcinoma microinvasivo del collo dell'utero che sarebbe potuto così avrebbe potuto estendersi.
Sylvia was told that she had to remove the uterus immediately before the cancer spread to other parts of the body. After a frantic research on the internet, and against everyone's advice, she chose to try Dr. Simmoncini's therapy instead.
Quindi praticamente hai fatto tutto da sola, cioè?
Ho fatto tutto da sola, infatti ho fatto tutto da sola. Ho acquistato immediatamente del bicarbonato e la sera stessa ho cominciato a fare questi lavaggi della durata di un'ora, un quarto d'ora per posizione, che erano il corpo sul fianco, poi il prona, e dopo neanche 2 mesi, diciamo 7 settimane, ho fatto un controllo il quale si è avverato completamente negativo, privo, diciamo, un controllo con una microcolposcopia che non ha rilevato nessuna anomalia cellulare.
Since then, Sylvia has had 5 follow-up checks, which all turned out negative. Even more stupefied are the friends and family around her who had initially pressured her to remove the uterus.
E adesso che dicono queste persone?
Adesso sono così, tra l'ammirazione e la sorpresa e l'infinità, perché mi vedono, sto bene, non ho più nessun tipo di...
soprattutto poi come te l'avevano messa, che è assolutamente urgentissimo.
Urgentissimo, sì, è veramente incredibile.
Io mi chiamo Annalisa
nel 2002 ho avuto questo tumore al cervello.
In 2002, Annalisa Grillo was diagnosed with a brain tumor called astrocytoma. She underwent surgery, followed by chemo and radio cycles, only to see a relapse in 2006. The consequences of the second surgery were even worse.
La seconda operazione che mi ha lasciato paralizzata per metà corpo mi hanno portato a questo, quindi mio marito Massimo si è dedicato ad altri tipi di medicina.
E tra le varie possibili ho creduto di iniziare quella del dottor Simmoncini, una cura a base di sodio bicarbonato endovena.
After 4 cycles of sodium bicarbonate, the RMI test showed a small reduction in the tumoral mass.
Dopo un po' di tempo, qualche mese più o meno, si sono verificati i primi risultati positivi.
A second set of 4 cycles reduced the mass of the tumor even further. The last 14 cycles, between March and August 2007, managed to clear the tumor completely.
La quale cura ha portato alla totale regressione della lesione, permanendo ad oggi soltanto un piccolo esito tipo cicatriziale postumo dell'intervento.
Dr. Simmoncini believes that also skin cancers are caused by a fungus, and treats them with regular iodine tincture.
My name is Dragan Misic and I come from Perth, Western Australia. Because in Australia, especially Perth, they couldn't cure my basal cell carcinoma and melanoma, I had 2 operations and many treatments with liquid nitrogen. But they completely damaged my skin.
And what did you do after that?
I applied the same therapy that Dr. Simmoncini described in his book, Cancer is Fungus. I applied that for about, a few weeks, and
the cancer is gone?
Totally gone. For the first time, I feel, cured and free, and I feel like I got my life back again.
Same story for Gemma, who had a basalioma on her chest and cured it with the same procedure.
Una dimostrazione come dovevo spennellare con la tintura di iodio, io ho capito perfettamente, ho continuato e tempo 2 mesi, come c'era scritto nel libro, è andato via.
Not every cancer, however, can be cured with the same effectiveness. Bones, for example, receive hardly any blood at all, and are very difficult to reach with the proper amounts of sodium bicarbonate. Different techniques, in some cases, can be applied. The last testimony is from someone who found himself on both sides of the fence at the same time. A doctor, who got cancer.
Io mi chiamo Carmelo Lombardo.
Di mestiere?
Sono nato, mestiere faccio il medico.
After the removal of a primary tumor in the bowel, Dr. Lombardo learned he had some metastasis at the liver. Just before undergoing the liver surgery, he learned that he had also developed a metastasis in each of his lungs.
Ormai avevo detto vabbè, quando sono stato operato dalla mia carica l'ho detto, però pensavo di avere se no 1 anno e mezzo, 2 anni, forse.
After returning home, Dr. Lombardo found out about Dr. Simmoncini's therapy, and chose to use the ports that had been prepared for the chemo, to introduce the bicarbonate solution instead.
Ah, quindi lei aveva il port per la chemio e invece l'ha usato per infilare il bicarbonato?
Sì, per il bicarbonato, sì.
E il port dove ce l'aveva esattamente?
Il port ce l'ho all'altezza della seconda costola, precisamente hanno incannulato la carotica interna e raggiunge la cava superiore.
After a few cycles of sodium bicarbonate, a TAC exam revealed both tumors had disappeared from each of his lungs.
Con esame fatto con mezzo di contrasto e senza contrasto non si apprezzano lesioni né di tipo primitivo né di tipo secondario.
Lei ha un messaggio da dare ai suoi colleghi medici? Di qualcosa?
Ai colleghi medici sicuramente, io dico la frase che dico sempre: la verità a volte è davanti alla punta del nostro naso, ma è talmente vicina che non riusciamo a metterla a fuoco, quindi a vederla. Quindi cerchiamo, e poi un'altra cosa, la verità non esiste una verità. La verità non è qualcosa che tu puoi pensare di possedere. La verità è ricerca, la verità la trovi soltanto se ampli i tuoi orizzonti, se allarghi il tuo modo di vedere.